Assalamu alaikum. Hello, dear friends. I'd like to introduce a new series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it and the responsible person for each step. In this video, we will talk about assessment and reassessment of patients. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with likes and follow. This policy is applied to all healthcare workers and we mention the name of the hospital. Purposes: 1. Identify patient healthcare needs. 2. Unify the assessment and reassessment process by the healthcare workers at name of the hospital. Definitions. Number 1. Assessment. The method of identifying patients' healthcare needs per visit to the hospital, either as outpatient or inpatient, through the systemic collection and review of data collected through the patient's focused observations, measurements, and diagnostic tests. Number 2, reassessment refers to the continuous process of data gathering to determine significant changes or the continuance of needs. Reassessment provides ongoing data about the patient's status. The scope, frequency, and extent of reassessment are based upon the patient's diagnosis, the level of care required, the patient's consent and acceptance of care, and the patient's response to previous care interventions. Number 3, assessment data collected through the assessment will be utilized to identify and prioritize patient care needs. Assessment data includes biophysical, psychological, functional, nutritional, and educational data as shown. Number 4, healthcare professionals refer to the clinical staff responsible to make assessment of patients to provide care to them. These include treating physician, assigned nurse, physiotherapist, nutritionist, patient educator, social worker, laboratory technician, and radiology technician. Number 5, SOAP method. This is a comprehensive method used during patient regular reassessment and includes collecting subjective information by interview, objective information by physical examination, appraisal of patient needs, and plan of needed care. Policies. Number 1, patient assessment is performed to identify patient's needs when patient has been registered or admitted to hospital for inpatient and outpatient care. Number two, the specific information required depends on the patient needs and the setting in which care is being provided. Number three, the minimum contents of assessment, including history and physical examination, are determined for each clinical specialty based on applicable laws and regulations and professional standards as shown in the attachment forms for each clinical discipline. Number four, the initial patient assessment includes also an evaluation of physical, psychological, social, and economic factors. Number five, emergency care needs. In emergency patients, the initial medical and nursing assessment is based on their needs and conditions. When there is no time to record the complete history and physical examination of an emergency patient requiring surgery, a brief note and preoperative diagnosis recorded before surgery. Medical assessment of emergency patients include the following. Number six, physician conducts initial assessment for the patient within 24 hours of admission to name of the hospital or earlier as shown in assessment reassessment timeframes table below. Emergency patients are assessed immediately, ICU patients within 4 hours. Number seven, assign nurse complete initial patient assessment and document it in the patient's medical record within 8 hours of admission to name of the hospital or area according to patient condition. Number eight, when the initial medical assessment is conducted in outpatient settings prior to admission, it must be within the previous 30 days, and any significant changes in the patient's condition since the assessment are noted at admission. If the medical assessment is more than 30 days old, the medical history must be updated and physical examination repeated. Number nine, the hospital will have complete and accurate medical record for each patient assessed or treated. The medical record will contain sufficient information to identify the patient, support the diagnosis, justify the treatment, document the course of action and results, and readily available for those responsible for the patient care. Number 10, patients for which anesthesia and or surgery are planned have a medical assessment performed before surgery and any diagnostic tests documented in the patient's record. Number 11, nutritional screening. Patients are screened by the registered nurse to identify those at nutritional risk according to the following. If moderate or high nutritional risk, please notify the clinical dietitian. and also by treating physician according to the following table. When it is determined that a patient is in nutritional risk, patients are referred to the dietitian for further assessment and treatment plan for nutritional therapy. Number 12, functional assessment. Patients are screened for functional needs to determine the level of functional ability. Evaluation could include fall history, medication and alcohol consumption review, gait balance screening, impaired mobility and using of walking aids, impaired vision, auditory deficit, orthostatic hypotension, frequent urination and change of mental status, especially with advancing age. Assessment of each patient risk for fall is done by registered nurse using a valid reliable tool. Patients who require further functional assessment should be referred to physiotherapist for further evaluation and treatment. Number 13, pain assessment. 1. All inpatients and outpatients are screened for pain and assessed when pain is present. 2. When pain is identified, an assessment of the cause of patient's pain includes but not limited to character, location, intensity, frequency, duration of pain, aggravating and relieving factors, and effect of pain on daily activities, current pain medication and effectiveness, contributing psychological factors, spiritual and cultural beliefs. 3. There is a standardized screening and assessment form for pain according to age group. Number 14, special population assessment and need for additional specialized assessments. The initial assessment of certain types of patients or certain patient populations requires the assessment process be modified. 1. Such modifications is based on the unique characteristics of needs of each patient population according to the following criteria. A. Age, pediatric and frail elderly patients. B. Condition with characteristic needs. For example, terminally ill, intensive or chronic pain, women in labor, women experiencing termination in pregnancy, with emotional or psychiatric disorders, with infectious or communicable diseases, and patients receiving chemo or radiation therapy. C. Critical nature of their needs. Patients suspected of drug and or alcohol dependency, victims of abuse and neglect, and patients whose immune systems are compromised. 2. Abuse clinic. Whenever any patient is suspected to be abused or complained of any kind of abuse, he or she will be referred to abuse clinic. 3. If the specialized assessment need is not available in the hospital, The treating physician prepares a clinical summary. The clinical summary is sent by facsimile. If the patient is accepted for consultation, patient transfer outside the hospital policy is followed. Number 15, assessment of dying patient and their families. Medical assessment and reassessment to be individualized to meet patients and family needs. When patients are at the end of life, assessment and reassessment of the dying patient should include the following. Number 16, additional specialized assessment. The initial assessments process may identify a need for other assessments such as dental, hearing, eye, and so on. According to the need of patients, additional specialized assessment is identified and referred to inside or outside the organization. Specialized assessments conducted within the hospital are completed and documented in the patient's record. Number 17, the initial assessment includes determining the need for discharge planning due to age, lack of mobility, continuing medical and nursing needs, or assistance with activities of daily living, among others. As arrangements for discharge may take some time, this should be conducted as soon as possible after patient's admission. Number 18, patients are reassessed by all healthcare providers at intervals based on their condition to determine their response to treatment and plan to continue treatment or discharge. A. Inpatients are reassessed at least daily, including weekends or more frequently depending on their needs. B. Outpatient reassessment is determined by the treating physician according to their needs. Number 19, assessment and reassessment are documented in the patient's record to help integration of services between medical team members. Procedures and responsibilities. In this table, we show the sequential steps needed for the assessment and reassessment of patients with the assigned responsible person. assessment and reassessment time frames. This table shows the assessment and reassessment time frames for staff members in different specialties. And here are the special circumstances assessment reassessment time frames. And this table shows the minimum assessment content. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Attachments of this policy include all forms needed to apply it. I'll show two examples. If you need any other form, please send me. Our first example is adult outpatient general sheet. The header of this sheet usually includes hospital name and logo with some basic information about the healthcare record number, patient data, consultant, and department and unit. Then it includes, in addition to date and time, chief complaints, past history, family history, and findings of general examination, heart examination, chest examination, abdominal examination, and neurological examination, in addition to the provisional diagnosis. Then we should document investigations. and treatment, current and recommended. Then patient follow-up, patient and family education, referrals and transportation if any, and signature and stamp. The second example is outpatient nursing assessment for adults. Header is the same with hospital name and logo. Then date, time and clinic, chief complaint, vital signs, pain screening and score, and allergy. Then nutritional screening and abuse screening. Then full risk assessment, which is valid only for 24 hours after the last dose of any of the listed medications. This form needs the nurse signature with date and time. This is a list of all other forms used with this policy. If you need any of them, please send me. Thank you. Thank you.